Myself, Dr. JIBRAN Ahmad presents to you Simply Pathology, and today we are back with a very important session, that is semen analysis. Okay, so semen analysis, if you see, it is very important from your exam point of view, because this question is asked in your exams every year. It is going to be asked either in your theory or it is going to be asked in your practical, but this question will be asked to everyone. It is a very important question. Secondly, why it is very important? Because this topic and this particular semen analysis, it is not carried out routinely in all the government or private medical colleges from where you are doing your residency. But when you pass out and when you have to practice, okay, in that situation, every lab offers the semen analysis test and they expect you to know this from the very beginning. So for your private practice, okay, this is very important. Now, why this session again is very important? Because this is the updated, okay, this is the updated version of the WHO semen analysis which has come in 2021. That is the WHO 6th edition, okay, 6th edition. Prior to this, we had the 5th edition, okay, which was released in 2010. So after a span of 11 years, WHO has updated. Now it is very important to understand, because all the reference values have completely changed in the 6th edition in comparison with the 5th edition. Okay, so you have to get yourself updated as well. So let us begin today's topic of discussion without wasting any more time. So I have divided this particular session into 11 particular parts. Excuse me. So we are going to cover some parts of the semen analysis in part 1, that is in today's lecture. Okay, and then we are going to complete the rest of them in the second part, that is the part 2. So in the first part as well in the part 2, so what are the things that we are going to read? We are going to see the basic introduction, okay, that is what is semen, what is seminal fluid, okay, then how it is produced, okay, and what are the contributions of the different parts of the MGT towards the formation of the seminal fluid. What are the indications of doing the semen analysis? Okay, what are the normal values according to the WHO 2021 6th edition? Okay, then what are the guidelines which are given by WHO for sample collection? What are the physical parameters and how the physical or macroscopic examination has to be done? So mind it, all the examiners who are coming in the exam, okay, they will ask you minutely all these details, and if you fail to answer, this is going to create a very bad impression on the teachers. Okay, so this is a very easy topic and this is a very scoring topic, so you should pay a lot of attention. Then we have the microscopic examination, wherein we are going to read that how we have to thoroughly mix the sample, how to make a wet preparation, then what are the parameters like sperm motility, then we have the sperm vitality, sperm numbers, sperm morphology. So in today's topic of discussion, we are going to cover all these topics, okay. And in the microscopic examination, we are going to see how we make the wet preparation and how we are calculating the sperm motility as well as the sperm vitality. Okay. In the next lecture, we are going to start with the sperm concentration as well as the sperm number, and we will see the sperm morphology. Okay, in the part 2. Along with that, we are going to see what are the immunological assays which are available, like the MAR test. Okay, then the biochemical assays, then the sperm function test or functional assays. This is a very hot exam question which is going to be asked to you, because all these are introduced in details in the 6th edition. What are the sperm function test or the functional assays? Then the examination for presence of semen in medico-legal cases. So this is on the rise as of now, and it is a must for a pathologist to know this particular section, as well as examination of semen to check the effectiveness of vasectomy. Okay, so I hope this point is crystal clear to everyone as to what we are going to learn in our semen analysis. Okay, so in today's topic of discussion, this is the portion that we are going to cover up till the sperm vitality. In the next session, we are going to cover the rest of the portions. Okay, so before we start, okay, all of you, you always ask me that, sir, can you give us an idea of about the semen analysis report, how the reporting is done. Okay, so how it is written. So this is the sample report, as you can appreciate over here. So all the patient details has to be given over here. Then all the sample which is collected at which place, okay, whether it was a home collection, whether it was in the laboratory, okay, then it was collected on which date, reported on which date, all the details has to be given over here. So what are the important components or the most important components that you see in a report? Very important is the physical examination, comprising the time of specimen, the time of examination, the duration of abstinence from sex, liquefaction at 37 degrees Celsius, okay, then the physical parameters like the volume, appearance, color, viscosity and the pH. So individually we are going to discuss each and every point in details, okay. Then comes the microscopic examination, the total sperm concentration, percentage, motility. There are different types of motilities like grade A, B, C motility is there, okay. Then vitality, what is vitality, okay. Then we are having agglutination, pus cells, RBCs and epithelial cells. So these are the other components other than the sperms which are present and which also might give you an important insight, okay, into the evaluation of semen. Then there is a morphology, normal and abnormal morphology, okay, and the percentage of each, the head defects, neck and mid piece and tail defects. Sometimes some laboratories are also including the biochemical assays like the semen fructose, the qualitative test whether it is present or no. So apart from this, okay, if required, if these are the, this is the routine semen analysis and these are the components of the routine semen analysis. Now, for example, if you cannot come to a conclusion, okay, after a routine semen analysis, after multiple routine semen analysis, you are not having or you cannot, understand what is wrong. In that case, you can go for the immunological assays or, in details, you can go for the biochemical assays or the sperm function test, okay, which we will discuss in the next part, okay. So this is how a routine semen analysis report looks like, okay. So let us now begin our topic of discussion. So basically, what is the semen? The semen or seminal fluid is a fluid that is emitted from the male genital tract and which contains the sperms that are capable of fertilizing the female ova. Now, during ejaculation, the semen is produced from a concentrated suspension of a spermatozoa which is first stored in the epididymis. Then it is subsequently mixed with and as well as diluted by the fluid secretion from the accessory sex organs like the prostatic gland and the seminal glands, okay, seminal vesicles. So 90%, remember 90% of the semen volume is made up of secretion from the accessory organs, mainly the prostate and the seminal vesicles, with minor contributions from the bulbourethral or Cowper's gland and the epididymis. So what are the contributions of the different parts of the MGT towards the seminal fluid? So the testis and the epididymis contributes only 10% and this is basically the sperms, okay. The seminal vesicles, if you see, is contributing 50%, whereas the prostate is contributing 40% and the Cowper's gland, that is the bulbourethral gland, is a very small amount of volume, okay. So these are the contributions, okay. So this is a very important viva question in the exam. Now, semen has two major quantifiable attributes, okay. So when I am talking about quantifiable attributes, that means this term is actually coined by WHO. So the examiner might just ask you plainly, what are the quantifiable attributes of the semen? So basically, so you will get confused, okay. So only those individuals who have read the WHO will be able to answer such questions. So what are the major quantifiable attributes? There are two things. You will get the total number of spermatozoa and the total fluid volume. Okay, so the total number of spermatozoa, it reflects the sperm production by the testis. It is also reflecting the patency of the post-testicular duct system. Okay, now it is also indicative of the efficacy of smooth muscle contractions in the epididymis and vas deferens to transport the sperms as well as the erectile and ejaculation efficiency. So this third point, if you see, it has been introduced as the latest major update in the 6th edition of the WHO. Okay. Again, the second important thing is the total fluid volume, which is reflecting the secretory activity of the accessory gland, that is the prostate and the seminal vesicles. Not only that, also the efficiency and the efficacy of the smooth muscles which are emptying it from the glands. Now, what are the different structures which are involved in the production of the semen? So, you are having the testis, the male gametes or the spermatozoa, that is the sperms, they are produced by the testis and they constitute 2 to 5% of the semen volume. Okay, the epididymis, if you see that after emerging from the testis, the sperms are basically stored in the epididymis where they undergo maturation. Over here, the epididymis is adding potassium, sodium, glycerol, phosphoryl, choline, which is an energy source for the sperms. These are secreted and they are added to the sperms. Inside the vas deferens, the sperms travel through the vas to the ampulla, which is another storage area. Ampulla secretes argothionine, which is a yellowish fluid that reduces chemicals, and fructose, which is a source of nutrition for the sperms. Okay. Now the seminal vesicles, if you see, during ejaculation, the nutritive and lubricative fluids secreted by the seminal vesicles and prostate are added. So the seminal vesicles, okay, the fluid secreted consist mainly of fructose. Okay, so fructose majorly is coming from the seminal vesicles, which is an energy source. Okay, as well as they secrete amino acids, prostaglandins, etc. They constitute 50% to the seminal volume, as we have already seen. The prostate, as you can see, they constitute 40% of the semen volume and consist mainly of acid phosphatase, proteolytic enzymes. So these are MCQs. Remember, proteolytic enzymes, they come from the prostate. Fructose majorly is coming from where? From the seminal vesicles. Okay. Storage, mainly maturation and storage is taking place where? It is taking place at the level of the epididymis. So these questions are very important, and these MCQs are asked in your exams as well as they are asked in the NEET super speciality or the INI-SS super speciality examinations as well. If you see the bulbourethra or the corpus gland, they secrete mucus. Okay. So now very importantly, and a very important, okay, MCQ question which is asked in the exam. So what are the indications of this semen analysis? It allows for direct examination of the male germ cells that is not possible with the female germ cell. So that is why semen analysis becomes very important. So the first major indication is investigation of infertility. So in the exams, when the students are being asked about this question, they are only answering that infertility, and after that they are not able to say anything. So semen analysis is the first step in the investigation of infertility, as about 30% cases of infertility are due to the problem with males. Okay, also it is done to check the effectiveness of vasectomy by confirming the absence of sperms. Okay, to support or to disprove a denial of paternity on the grounds of sterility. Okay, to examine the vaginal secretions or clothing stains for the presence of semen in case of medico-legal cases. For the selection of donors for artificial insemination. For selection of assistive reproductive techniques, example in vitro fertilization as well as gift techniques. Okay, so these are basically the indications of carrying out the semen analysis. Now very importantly, we are going to see what are some of the normal values for semen analysis, and this is very, very important. Now these values, these are according to the WHO WHO 6th edition. These are in accordance with the WHO 6th edition that it came in 2021. Now what is the importance? Let me tell you. Let me take you back, okay, to this report. If you look at this report, if you look at the reference values, so all these reference values, if you see, they are according to the 2010 WHO 5th edition, right? But right now, since the WHO 2021, okay, 6th edition, when it is already out, so the reference value should be in accordance with that. Okay, so that is why this becomes very important lecture for you people. Okay, so let us see the normal values. So the normal values for the semen analysis, let us see. So over here we have all the different parameters, and we have the 5th percentile. What is the meaning of 5th percentile? It means the lower reference limit, that if anything is less than this, then it is abnormal. So we have to know the lower reference limit, and this is the range of the lower reference limit, that is the 95% confidence interval. Okay, so let us see number 1, that is the semen volume, which is measured in ml. Okay, so the lower reference limit is 1.4 ml and the 95% confidence interval is 1.3 to 1.5. If you look at the pH is usually alkaline and more than equal to 7.2. If you look at the normal appearance, normally the semen analysis, if you see the semen, it is homogeneous, cream or grey opalescent. Previously only the term homogeneous grey opalescent was there. The term creamy has been recently introduced in the latest edition. Viscosity, if you see, it forms a small discrete drops, threads less than 2 centimeter long. If it is more than 2 centimeter long, it is abnormal and highly viscous semen sample. Now the completion of liquefaction of ejaculate should occur within 30 minutes at room temperature. Then we have the different kinds of motility. So progressive motility, the percentage is 30% and the range is 29 to 31%. Non-progressive motility, if you see, it is 1 and the range is 1 to 1. Total motility is addition of your progressive plus non-progressive motility, and it is 42. Okay, and the range, the lower reference range is 40 to 43. Immotile spermatozoa, if you see as a percentage, the fifth centile of the lower reference limit is 20 and the range is 19 to 20. If you look at the vitality, okay, normal vitality is 54% and the range is 50 to 56. Okay, if you look at the morphology, the percentage in normal morphology, it is 4 and the range is 3.9 to 4%. Peroxidase positive leukocytes, usually they are less than 1 into 10 to the power of 6 per ml. And if you are suspecting immunological factors, we are carrying out mixed antiglobulin reaction, that is basically an immunological assay. So less than 50% motile sperms should have the adherent particle, that is in normal conditions. Sperm concentration, if you see, it is around 16 million per ml. Okay, it is 16 million per ml and the range is 15 to 18. This is a lower reference, at least 16 is there. And total sperm number, okay, it is nothing but the sperm concentration into the volume of the semen sample. So it is in the range of 39 to it is the average or the lower reference limit is 39 millions per ejaculate and the range is 35 to 40 million per ejaculate. Okay, okay. So this is all about the normal values and you should remember the normal values by heart because they are asked in the exams. Okay, okay. Next, we are going to see the basic outline of the semen examination. So there are three important stages. Okay, the first important stage, it is the pre-examination procedure, then the examination procedure, which is again subdivided into three, and there is the post-examination procedure. Okay, so there have been slight changes in these procedures and the inclusion of the different exam procedures. Okay, in comparison with the WHO 5th edition. So what all are done in the pre-examination stage? So the patient information, very important, sample collection and sample reception, as we had already seen in the report, sample collection date, sample reception, at what time and after what time it has been, what time it was collected and at what time it was received in the lab. Okay, then initial sample handling. Okay, what are those? Okay, so initial handling sampling means what is done in the first 5 minutes of reception of the sample. You should measure the semen volume and you should allow time for liquefaction. So previously, this measurement of semen volume wasn't there under this pre-examination procedure. It was in the examination procedure. But in the 6th edition, they have introduced this in the first 5 minutes or in the initial sample handling. So in the pre-examination procedure, you have the patient information and particular sample collection, reception, initial sampling handling, that is in the first 5 minutes you should measure the semen volume and you should allow the time for liquefaction. Then the examination procedure. So between 30 and 60 minutes, what are the things that you should do? So basically you should assess the liquefaction, number 1. Number 2, microscopic examination of the semen, measuring the semen pH if it is indicated, preparing a wet preparation for assessing microscopic appearance, okay, sperm motility and the dilution which is required to assess the sperm number. Okay, these three things are done in the wet preparation. Also, you can assess the sperm vitality. Now, sperm vitality is only carried out, this test, if the percentage of motile cells is low. If it is less than 40% motile sperms, then we carry out the sperm vitality test. Making the semen smears for assessing the sperm morphology. Making the semen smears for assessing sperm morphology. Make dilution for assessing the sperm concentration. Performing MAR, mixed antiglobulin reaction test, that is the immunological test. If required, it is done during this time. Assessing the peroxidase positive cells, which is indicative of presence of leukocytes. Okay, basically under the microscope these are as the round cells, but there are multiple structures which can come as a round cell. To confirm whether they are leukocytes or not, we are carrying out this peroxidase test. Then we have the immunobead test if it is required, and we have the centrifuging semen, you can centrifuge the semen sample which is done to assay the biochemical markers. Okay, so all these tests they are to be carried out under the examination procedure between 30 to 60 minutes. Then under the examination procedure there are certain tests which has to be done within 3 hours. So what are those? Sending the samples to the microbiology laboratory, and it is not routinely done if it is required then. Else within 3 hours you can also do the sperm concentration and the sperm number. It can be done later, preferably on the same day. So previously in the previous edition, the sperm number and concentration, it was between 30 to 60 minutes, but now they are saying okay, it can also be done within 3 hours, and also it can done on the same day, but at any time after 3 hours also can be done. Okay, so it is not something that has to be carried out at that instant only. The sperm concentration and sperm number can be carried out within 3 hours, and if cannot, then can be done later on, but on the same day. Later, okay, the same day or on a subsequent day. So the fixing, staining and assessing the smears for the sperm morphology. So this can be done later, either on the same day or on a subsequent day can be done. Assaying the accessory gland markers if required, again not a special test. Performing the indirect immunobead test if required. So these are the examination procedures which are carried between 30 to 60 minutes, okay, within 3 hours, and which is on a later but on the same day or on a subsequent day. Now what are some of the post examination procedures? You have to do the calculations, the results presentation, approval of results for release. Okay, so these are some of the these are the basic outline of the semen analysis that has to be carried out. Okay. Now we are going to start with the physical examination of the semen sample. So the first and the very important thing that we have to do is the sample collection. So let us see how we have to collect the sample and what are the procedures for collection of the sample as given by the WHO. Okay, and we are going to see what are the different kinds of instructions that we have to give to the patient who is giving the semen sample. Okay, so the sample should be collected in a private room which is located inside the laboratory. Why? In order to limit the exposure of the semen to the fluctuations in temperature and to control the time between collection and analysis. The sample should be collected after a minimum of 2 days and a maximum of 7 days of sexual abstinence. Okay, this is the criteria which is given by the WHO 6th edition. But in our country, usually in our country, the basic thing is some of the laboratories they are following WHO and some of the laboratories they are not following WHO. Okay, so those who are not following, or sometimes in some other books you will see some other values. Okay, but according to the WHO, the sample should be collected after a minimum of 2 days and a maximum of 7 days of sexual abstinence. There are some other schools of thought also. Some people say that the semen sample is collected after about 3 days of sexual abstinence. Longer period of abstinence reduces motility of the sperm. If the period of abstinence is shorter than 3 days, the sperm count is lower. Okay, so these are the reasons why there should not be lesser abstinence and even more abstinence. The man should be given clear written as well as spoken instructions concerning the collection of the semen sample. These should emphasize that the sample needs to be complete and that the man should report any loss of any fraction of the sample. Why is it so? Remember, the first part of the semen sample that comes out, okay, it is the most concentrated usually. Suppose that person did not hold the container properly and the first part was lost. Then, and if the person does not report the same, then he might get a falsely lower count of the sperms. So this is the reason that you have to, always give proper instructions to the person. Examination should commence within 30 minutes after collection, but at least within 60 minutes of collection. So the maximum time after which the examination should be started is 60 minutes, okay, not later than that. Now the following information should be recorded on the report form: the man's name, the birth date, personal code number, the period of abstinence. If you see the report that I showed you, the period of abstinence is there. The date and time of collection and the completeness of the sample, any difficulties in producing the sample, the interval between the collection of the sample and the start of the semen analysis, as well as the ejaculate volume. So these information, okay, in the first 5 minutes only, basically these information has to be recorded. Now, the ordinary latex condoms must not be used for semen collection because they contain agents that may interfere with the motility of the spermatozoa. Also, certain condoms, if you see, they might contain a spermicidal agent which can again interfere or be spermicidal as well. It can kill the sperms. Coitus interruptus is not a reliable means of sperm collection or semen collection. What is coitus interruptus? Okay, when you know at the time of climax, okay, you pull out the penis out of the vagina, so that is coitus interruptus, okay, for collecting. Why it is not a reliable mean? Because the first portion of the ejaculate, which contains the highest number of spermatozoa, they may be lost. Moreover, there may be cellular and bacteriological contamination of the sample, and the low pH of the vaginal fluid could adversely affect the sperm motility. Now, if a man cannot provide a semen sample, the post-coital test may provide some information about the spermatozoa. So, this is how the sample has to be collected. Now, some of the important points for collection of the semen for diagnostic or research purpose when it is done in the laboratory itself. The sample should be obtained by masturbation and ejaculated into a clean, wide-mouthed container made of glass or plastic from a batch that has been confirmed to be non-toxic for spermatozoa. The semen or the specimen container should be kept at an ambient temperature between 20 to 37 degrees Celsius to avoid large changes in temperature that may affect the spermatozoa after they are ejaculated into it. It must be labeled with the man's name, identification number and date and time of collection. The specimen container is placed on the bench or in an incubator at 37 degrees centigrade while the semen liquefies. Sometimes when the specimen is placed in the bench, that bench is rotating like this. They have a movement, okay. So basically such bench, they are not only allowing for liquefaction and providing an ambient temperature of 37 degree, but they are also helping in mixing of the particular sample. Note in the report if the sample is incomplete, especially the first sperm rich fraction that may be missing. If the sample is incomplete, a second sample should be collected again after a period of abstinence of 2 to 7 days. Now, the collection of semen at home or any place other than the laboratory. A sample may be collected at home or at a place other than the laboratory in exceptional circumstances such as demonstrated inability to produce a sample by masturbation in the clinic or the lack of adequate facilities in the lab. Now, the man should be given a pre-weighed container labeled with his name and identification number. The man should record the time of semen production and deliver the sample to the laboratory preferably within 30 minutes and no longer than 50 minutes after collection. So, these timings have been introduced by the WHO and modified and updated in the 6th edition. Now, during transport to the laboratory, the sample should be kept between 20 and 37 degrees centigrade. Now, the report should note that the sample was collected at home or another location outside the laboratory. Now, during transport to the laboratory, the specimen should be kept as close to the body temperature as possible, that is by carrying it in an inside pocket. Okay, so these are some of the guidelines for semen collection at home. So, in your Viva, it is a favorite question of examiner, okay, that how semen collection or what are the guidelines for semen collection outside the laboratory, okay. Okay, the next important parameter that we are going to see is the ejaculate volume, that is the semen volume. Now, the precise measurement of the volume is essential in any evaluation of ejaculate because it gives information on the secretory functions of the accessory sex gland, that is the semen, the seminal vesicles and the prostate and the prostate gland. A reliable ejaculate volume assessment is also necessary for calculation of the total number of spermatozoa, the total number of non-sperm cells in the ejaculate and the total amounts of biochemical marker. So, these are some of the important uses of calculation of the semen volume and this will be asked to you in the exam. So, how is it that you collect? Okay, let us see. Now, the volume of the ejaculate is contributed mainly by the seminal vesicles and the prostate gland with a small amount from the bulbourethral glands and the epididymis, as we have already seen before. Now, the best and the most important and the accurate way of measuring the semen volume is the volume by weight method, and this method has been emphasized by the WHO 6th edition semen analysis manual, they highly recommend to go for the volume by weight method. Over here, the volume is best measured by weighing the sample in a vessel in which it is collected, that is the container. And remember, the container in which we are collecting, I already told before at the time of sample collection that that container has to be pre-weighed. So collect the sample in a pre-weighed, clean, disposable container, weigh the vessel with the semen inside it, subtract the weight of the container from that. So you are going to get an accurate sample weight. Now you can calculate the volume from the sample weight, assuming the density of semen to be 1 gram per ml. Okay, so all of us, we know density is equal to mass by volume. Therefore, volume is equal to mass divided by density. So basically, the density of semen is 1 gram per ml. So whatever volume you are getting, okay, it is equal to the, or whatever mass you are getting, it is equivalent to the volume itself. Okay, so it is approximately like this, and this is the calculation that you have to carry out for the correct assessment of the semen volume. Alternatively, the volume can be measured directly. Collect the sample directly into a modified graduated glass cylinder with a wide mouth. These can be obtained commercially. Read the volume directly from the graduation. So let me show you. So this is a graduated chamber. So from this particular container, you just transfer it into a graduated glass tube, as you can appreciate. You can either do it directly, or you can use the help of a pipette to transfer the same. And over here, till whichever number you are getting, the semen sample will give you the reading. Okay. Now, low semen volume is characteristic of obstruction of the ejaculatory duct or congenital bilateral absence of the vas deferens, a condition in which the seminal vesicles are also poorly developed. Low semen volume can also be the result of collection problems like loss of a fraction of the ejaculate, especially the first portion, partial retrograde ejaculation, or androgen deficiency. So these are very, very important. Suppose in the in the semen analysis report, you are getting a low semen volume. So what is your inference? Okay, this can be the question of the examiner in the exams. A high semen volume may reflect active exudation in cases of active inflammation of the accessory organs. So what is the lower reference limit for the semen volume? As we have already seen, so in the latest edition, it is stated as 1.4 ml. That is the 5th centile. That is the lower reference limit. And the range for this lower reference limit, that is the 95% confidence interval, is between 1.3 to 1.5 ml. Okay, so this is about the semen volume. Next, we are going to see the appearance. So the appearance of the ejaculate. A normal liquefied semen sample has a homogeneous cream or gray opalescent appearance. It may appear less opaque if the sperm concentration is very low. Slightly yellowish. Okay, remember one thing, that the ejaculate can become slightly yellowish after a very long abstinence time. So remember this point. Okay, now the color may also be different. That is, the reddish brown color can occurs when the red blood cells are present, which is called as hemospermia. Or a clearer yellow color occurs in a man with jaundice or who is taking any kind of vitamin or drugs. Okay, so this is about the appearance. As you can appreciate over here, this semen sample over here. Okay, so what is the color? It is grayish opalescent. It is grayish opalescent, grayish creamy homogeneous opalescent, as we can appreciate over here. Now, very important, before I go to the next important physical parameter, I would like to highlight something about the safe handling of the specimen. Now, semen samples may contain dangerous infectious agents, example HIV or hepatitis virus or herpes simplex virus, and they should therefore be handled as a biohazard. Now remember, the initial microscopic examination, the semen analysis should begin with simple inspection soon after liquefaction, preferably at 30 minutes, okay, but no longer than 1 hour after ejaculation. Why? This is to prevent dehydration or changes in temperature from affecting the semen quality. So very importantly, first we are having the liquefaction. Okay, so immediately following ejaculation, okay, very important, the liquefaction, that is the next important attribute. So immediately following ejaculation, the normal semen is thick and viscous. It becomes liquefied within 30 minutes by the action of proteolytic enzymes secreted by the prostate. Okay, so immediately after ejaculation into the collection vessel, the semen is typically a semi-solid coagulated mass. Okay, within a few minutes at room temperature, the semen usually begins to liquefy, that is, becomes thinner. at which time a heterogeneous mixture of lumps will be seen in the fluid. As the liquefaction continues, the semen becomes more homogeneous and becomes quite watery, and in the final stages only small areas of coagulation is going to remain. A temperature of 37 degrees centigrade will facilitate liquefaction process. Also, a slow swirling movement of the sample container will help liquefaction to complete. So if you just swirl like this for 15 to 30 seconds, it is going to help in the liquefaction process. If a moving tray, that is orbital mixer, is not used during liquefaction, it is essential that a container is slowly swirled for 15 to 30 seconds before starting the macroscopic assessment of liquefaction. Semen samples collected at home will normally have liquefied by the time they arrive in the laboratory. The complete sample usually liquefies within 15 to 30 minutes at room temperature. So see, these guidelines, they have been updated in the WHO 6th edition. So please pay a lot of attention. If liquefaction is not complete within 30 minutes, this should be recorded. Okay, you have to record that and noted in the final report. The ejaculated could then be left in 37 degrees centigrade for another 30 minutes to allow for liquefaction to complete. If liquefaction is not complete even after 60 minutes, this should also be included in the final report that liquefaction is not complete. Normal liquefied semen and semen samples may contain jelly-like granules, that is the gelatinous bodies, which do not liquefy. So normal liquefied semen samples may contain jelly-like granules which do not liquefy. These do not appear to have any clinical significance as such. So what is abnormal is, even if liquefaction is not complete after 60 minutes, it is abnormal and it is called as delayed liquefaction. So let me highlight the same. So liquefaction can be recognized both macroscopically, as we have seen over here, that when they completely liquefy, so they become homogeneous and they become watery, okay, in the final stages. And also microscopically you can confirm the same. So immobilized spermatozoa, they gain the ability to move as the semen liquefies. If immobilized spermatozoa are observed on microscopic examination, more time must be allowed for liquefaction process to be completed. So this is how microscopically you can judge liquefaction. So these are very relevant questions that the examiner will ask you, that how are you going to recognize liquefaction macroscopically as well as microscopically. It's very important to understand. Okay, so delayed liquefaction, as I already explained, that if liquefaction doesn't occur within 60 minutes, it is called as delayed liquefaction. So occasionally the samples may not liquefy, making the semen evaluation difficult. In these cases, additional treatment, mechanical mixing or enzymatic digestion may be necessary. So some samples can be induced to liquefy by addition of an equal volume of physiological medium, example Dolbeck's phosphate buffer saline, followed by repeated pipetting. Addition of culture medium can alter sperm motility and concentration as well as the biochemical markers. Inhomogeneity can be reduced by repeated gentle passage through a blunt gauge 18 or gauge 19 needle attached to the syringe. Okay, approximately 6 to 10 times you can do the same, but this process can damage the spermatozoa as well. You can also use digestion by bromelain, a broad specificity proteolytic enzyme which may help to promote liquefaction process. These treatments may affect seminal plasma biochemistry, sperm motility, sperm morphology, and their use must be recorded. Now remember, with this third method, that is the bromelain method, the 1:1, that is 1:2 dilution of semen with bromelain must be accounted for when calculating the sperm concentration or the sperm number. So I hope you have understood in details about the liquefaction process. Okay, the next important physical aspect. Okay, just let me show you with the help of a diagram. So can you appreciate over here, actually just see the semen sample over here. So this is now opaque, it is opalescent, okay, at the time of collection. Okay, after 15-20 minutes, just see the appearance. They become quite watery. As we can appreciate over here. Again over here, initially you can see the opalescence. Later on you can see how they are becoming clearer and they become more watery. This is the liquefaction, as we can appreciate over here. Okay, so this is very, very, very important to understand. So semen will become more homogeneous and quite watery. Okay, this is very important. This is a sign of liquefaction. Now the semen viscosity, the next important physical parameter. So after liquefaction, the viscosity of the sample can be estimated by gently aspirating it with plastic disposable pipette, allowing the semen to drop by gravity and observing the length of any thread. A normal sample leaves the pipette in a small discrete drops. If viscosity is abnormal, okay, the drop will form a thread which is more than 2 centimeter long. So remember, whenever you are taking with the help of a pipette, you are aspirating some amount of semen and you are just putting it back. If the threads which are formed is very long, more than 2 centimeter, it means it is abnormally viscous. Okay, it is abnormally viscous. So let me show you with the help of this diagram. Suppose you have aspirated and in the pipette you want to give it back. Usually after liquefaction process, when you see the viscosity of the sperm, it is less than 2 centimeters. So this length, the length of the thread which is formed is less than 2 centimeter, which is normal. But if the length becomes more than 2 centimeter, it becomes abnormal. It becomes abnormal. Okay. So alternatively, viscosity can be evaluated by introducing a glass rod into the sample and observing the length of the thread that forms upon withdrawal of the rod. The viscosity should be recorded as abnormal when the thread exceeds 2 centimeter, as I already told you. A viscous semen specimen exhibits homogeneous stickiness and its consistency will not change with time. High viscosity can be recognized by elastic properties of the sample, which adheres strongly to itself when attempts are made to pipette it. The methods to reduce viscosity are the same as those for delayed liquefaction. High viscosity can interfere with determination of sperm motility, sperm concentration, detection of antibody coated spermatozoa and measurement of biochemical markers. That is why you have to note it. You have to note this point because it can alter all these other parameters. Increased semen viscosity affects sperm motility and leads to poor invasion of the cervical mucus. It results from infection of the seminal vesicles or the prostate Okay. So we have already spoken about this. Okay. Viscosity. Now in the 6th edition, we can see that they have introduced something called as ejaculate odor. So there is a considerable variability in the ability of different individuals to perceive the normal smell of a human ejaculate. Now, information of a strong odor of urine or putrefaction can be of a clinical importance. It is therefore important to note this in the report. So if the odor is very strong, it might be indicative of some kind of infective process. Okay. So ejaculated odor has been introduced in the 6th edition as a parameter. Now the semen pH, okay, or the ejaculate pH. Now the pH of the semen reflects the balance between the pH values of different accessory gland secretions, mainly the alkaline seminal vesicular secretion and the acidic prostatic secretion. The pH should be measured after liquefaction at a uniform time, preferably after 30 minutes, but in any case within 1 hour of ejaculation, since it is influenced by the loss of carbon dioxide that occurs after production. Now for normal samples, the pH paper in the range of 6 to 10 should be used. Now very important, you should mix the semen sample well. Spread a drop of semen evenly onto the pH paper. Wait for the color of the impregnated zone to become uniform. It takes around less than 30 seconds to be so. Compare the color with the calibration strip to read the pH. Now the reference value, if you see normally if you look at the 6th edition, what they have said that the semen pH is less than equal to 7.2. Okay. If the pH is less than 7 in a semen sample with a low volume and with a low sperm number, there may be ejaculatory duct obstruction or congenital bilateral absence of vas deferens, a condition in which the seminal vesicles are already poorly developed, and as a result the alkaline secretion, that is mainly from the seminal vesicle, is absent and therefore the pH is falling. Semen pH increases with time normally, as I told you, okay, as natural buffering decreases. So high pH values may provide little clinically useful information. Okay. So as you can appreciate, this was a strip and over here a drop was placed. So you can see the color, you can match over here. So over here it is matching with the 7. Okay, this is how you have to see the pH of the semen sample. Okay. Okay. So with this we have completed in details about the physical examination and as well as the macroscopic examination. Okay. So thank you very much for watching this particular video. Next video, we are going to start with the microscopic examination. Thank you very much.